Dr. Schmidt gave a great overview of the regulatory framework and the things that happen, that have happened and could happen with that. And my effort this afternoon is to introduce you to the Swine Health Information Center and some of the things that we've got going on as a very quick overview of industry responsibilities and industry response. Swine Health Information Center mission: protect and enhance health, coordinated global disease monitoring, targeted research, and analysis of swine health data. Those three big buckets. That's what we've got going on as the mission, those three big buckets that we're working on. The scope of work includes, on the left-hand side, this global swine health and issues identification, putting together the networks of information to give us a heads up on what's going on around the world in order to be better prepared should we get something here. I'll harken back a lot to the lessons of PED. We've all gone through that. I'll harken back to the lessons of pseudorabies eradication and the pseudorabies program, of the emergence of PRRS, of the emergence of PCV. All of those things, these activities are all lessons to be learned, and the Swine Health Information Center is a reaction to those lessons. So maybe we can't prevent those things from happening again, but we can sure learn better how to manage them and how to react to them and what we need to do. First thing is get the network around the world with veterinarians, with animal health companies, with genetics companies, with universities. We're in a global society and global trade, and there's a lot going on that we can learn from that's out there outside of our borders in order to be able to help us be prepared. That leads to the top of this with what we term the Swine Disease Matrix Project. I'm going to show you the results of that, but what it amounts to is taking those risks that are identified from the international side and from emerging diseases that we find in the U.S., and making sure that we're as best prepared as we can, one, to find them diagnostically, and two, to be able to respond with the diagnostics we need in order to be able to manage them as quickly as possible. And then on the right side is swine health data analysis and monitoring. We've got a bevy of databases out in the industry. People are keeping records, companies are keeping records, universities are keeping records. There's a lot of data out there. And one of the things that we haven't done a good job of historically is synthesizing that all together so we can do an analysis on it and help us in the future. Not just what has happened previously, but to be able to do an analysis on it to help you with, if you do this, this is likely to happen. And if you do that, this is likely to be some of the outcomes. Good, bad, or indifferent. But analyzing that data to try to figure out how we can get information out to you to help in the future. And that leads down that right side to a project that has half of the sows in the country in the project that can help with that data analysis, the risk analyses that we can do from data, and as Dr. Schmidt talked about, the continuity of business with the secure pork supply and enabling pigs to move in the face of a highly contagious epidemic outbreak. Those are all some of the things that we're trying to get coordinated with the Swine Health Information Center. It is a project funded by the National Pork Board with your checkoff money. It is not a project of the National Pork Board. It's a separate organization. It's a separate corporation. And as such, it's got its own board of directors. National Pork Board, National Pork Producers Council, American Association of Swine Veterinarians, and producers at large all sit on and direct this activity. It's got a 5-year lifetime. As this project was being put together and the National Pork Board's Board of Directors was thinking about making investments in the future of the pork industry in the U.S., the proposal was to put money into this, give us 5 years to show return on investment and show an advantage to pork producers and veterinarians. The clock started in July of last year. And so there's 4 years and 6 months left. My view is that I've probably got 2 years and 6 months in order to be able to show a return on that investment. because we need to be able to demonstrate to you folks that return on investment and the value of this, and we aren't going to wait 5 years to do that. So this is a very focused, very intense effort to be able to use the funds from Chekhov funding this corporation to help you, and a lot of work's going into the issues that we've got right now. As part of, after July 1st, when this was formed, I had the opportunity to go around the country and talk to producers, veterinarians, academics, animal health companies, a wide variety of people, and talk to them about the Swine Health Information Center and bring up those three big buckets and say, here's what we're going to try to do to be better prepared. The response from all of that, and I hope that you can give me some questions in response as part of the question and answer period later. But the response from all of that really was very common. It's a good idea to be prepared, but preparedness isn't enough. You've got to be able to help us respond as well. So preparation is one thing, but we've got to be able to respond to these things as quickly as possible in order to be able to manage them as best as possible. And so don't just focus on preparedness, focus on helping the industry facilitate and coordinate a response. Because the point I made to all of these people is that the PERS, PCV, PED are examples of we're going to get something else. We aren't going to be able to put a big fence around or a big wall around on our borders and stop things from coming in. It's going to happen, and so we've got to be prepared. The response was, not only do we have to be prepared, but help us facilitate a good response to those issues as well. So that's a little bit of the background of the Swine Health Information Center, looking over the hill and that international monitoring and looking at the risks of things that can come in with the Swine Disease Matrix Project. There's a working group of experts, including producers, veterinarians, academics, people that have contacts overseas in other countries, and that includes China, South America, Europe, Central America, Australia. All of these places, we've got people together that know what's going on in those countries. And we put together this list of possible swine diseases with the help of USDA. They provided the literature review for this, and that group reviewed that list based on three things. The production impact that this virus could have should it get into the U.S., the market, domestic market, and international trade impact it could have should it get into the U.S., and the likelihood of it getting in there. And this is their prioritization of these diseases. Foot and mouth, classical swine fever, African swine fever, those are the big three foreign animal diseases. As you go down this list, I'll point out a few of them. The pseudorabies virus with a pathogenic Chinese strain, that's hitting China. That's an issue that they've got to deal with right now. That's not the pseudorabies virus that we eradicated back in the 90s and 2000s. That's not it. It is worse. It kills these pigs. It kills not only feeders, but finishers and sows alike. That one is a risk and something we have to be prepared for and be able to deal with. As you go down, the other thing that is a Chinese issue that is something to keep an eye on is this high pathogenic PERS strain that China has as well. When I had the opportunity to be in China in October of last year, I talked to the company veterinarian, the company production manager, and the people in the barns. And I said, what are the top three things that you've got to deal with right now, the diseases that you're dealing with? And they gave the same answer. One is foot and mouth disease, which thankfully we don't have. But then they listed PED and they listed the pseudorabies virus as the top things that they're working with. It's a harbinger of things that we have to pay attention to as we look here. Not only do we have that look, and not only do we have the disease matrix upon which we're going to do a lot of research work to make sure we're prepared diagnostically, but also with information. A list, take that matrix list and look at that, and we've developed fact sheets with the pertinent information that producers and veterinarians need to have on each one of those viruses should it get onto the farm. Again, a lesson from PED was that when we found PED, we collectively kind of looked at each other and said, what do we know about this? We got to put something together. We don't know about PED because it hasn't been on the radar previously. So we've had to put all that information together and get that. We're going to be better prepared with this information issue quicker this next time. The other lesson was we looked at how the industry could respond with finding out how PED got onto the farms, veterinarians and producers alike, with trying to figure out the risk factors for PED entry. And in doing that, what we did was fund what we termed rapid response teams. And that was veterinarians and epidemiologists that could get out onto a farm in response to an outbreak that was unique and try to figure out, try to offer some help both to the farmer and to the industry in trying to figure out how that virus got on there. What we found out from that was the surveys and the work that they did was fairly successful. The rapid part of that was absolutely a disaster. By the time we get out onto those farms, it was a week or 2 weeks later, things had changed, things are moving, and that was not nearly as successful as it could be. So part of the effort that we're trying to put together now, and something that we heard loud and clear after the PED outbreak, was we've got to be better in responding and figuring out what's going on quicker in order to give us better information, and that's part of this effort as well. A couple of other things that are going on in the Swine Health Information Center. Iowa State University, Kansas State University, University of Minnesota, and South Dakota State University all have their diagnostic databases with test results. They've all been developed from the time that they started with that IT issue and those electronics, and they did it each in their own manner. So each one of them have different codes for the test results, and none of them knows what the other one has for codes. It's an issue of building things in silos and not coordinating. We're trying to fix that to get the diagnostic labs to be able to provide those information among the diagnostic labs back to you, back to veterinarians, in order to be able to help better analyze that. There's a lot of data in there that is available and can help you if it can be standardized and if it can be analyzed. That's something we're looking at. And then there's another effort with, if we're going to have these diseases, if we are at risk, let's try to identify how we're at risk. Let's identify the sources of different viruses, how they could get in here, and then we'll help with what we can do to try to stop those. I'm not going to go into Seneca Valley as a disease. I'm going to offer that Seneca Valley is an example of a response from the Swine Health Information Center and your industry. Not just the Swine Health Information Center, but along with National Pork Board, National Pork Producers Council, American Association of Swine Veterinarians, and the state veterinarians and even federal veterinarians in responding to an emerging issue. Dr. Schmidt started with some of that timeline. I'm going to give you the timeline here of how SHIC, Swine Health Information Center, tried to facilitate response. And across the top there, the real issue here for us was assess the needs, fund the projects, and answer the problems. That's the bottom line of what we were trying to do with Seneca Valley, or what we'll try to do with the next one that comes. Needs, funding, and answer the problems. So in early July, we started with identifying these herds. There was noise about Seneca Valley happening. As we went through July, it was increasing, and the end of July, the 1st of August, it increased enough that it was obvious that this was not the historical Seneca Valley that you'd see 3 or 5 infections every summer and then that was it. This one was building. And so we started with the facilitation process through August, get the issues that needed to be identified, needed to be answered, for trying to manage this virus in our populations and on the farm, get that research going, get that research done, proposals, and get contracts and get it moving. So by the 1st of August until the 1st of October, we had things rolling in response to Seneca Valley virus. And these are examples of those research projects. And if you look on the right side, really that's the issues of what we've been trying to offer as far as research. The left side are the specifics, but the right side, we needed to understand the distribution of this virus around the country, because response would be different if it was widely spread or if it was on one farm. How you manage movements, how it gets on the farm, off the farm, how you can manage movements and enable a free herd from an infected one. What's different about this virus now that we haven't historically had? Seneca Valley's been identified in the U.S. since 1988, and something changed. We're looking into that, the tools that you could use to clean up, and how you can clean up the risk factors, and then making sure that we weren't missing something, that Seneca Valley was some sort of a shiny object, but really there was something lying underneath it. As well as that research, there was a lot of work on coordinating efforts. Both the industry, veterinarians, producers, veterinarians, SAHOs, state animal health officials, the federal animal health officials, everybody working together to try to coordinate this. Dr. Schmitz showed some of that epidemic curve, and I want to offer that the green bars, and you can see green bars, here is a bigger picture of that epidemic curve in the outbreak. The other bars, and those green ones, come from the veterinary diagnostic labs. It's an example of the work that can be done in coordinating that information from Iowa State and other veterinary diagnostic labs. Because that's really, you see the whole picture in there. The other colors are other various reporting mechanisms that really give not a very complete picture of what's happening. Swine Health Information Center is at swinehealth.org. There's a lot of information about Seneca Valley and all of these other diseases that are up there. I encourage you to take a look at it